Well, oncology is an interesting specialty because of a couple things. One, if you want to be successful in oncology, you have to know a lot about oncology, right? You have to be really, really educated. And unlike other specialties where it's pretty easy for non-healthcare entrepreneurs and companies to come into the market and offer really disruptive technologies. I'm thinking things like scheduling applications, telemedicine. In telemedicine, even if I don't have a background in healthcare, I use webcams all the time. I can conceptualize the workflow of don't want to go to the clinic, want to ping a doctor, want to have a webcam session with my doctor, done and done. That's a really simple, straightforward, understandable space. And so I can function without a lot of healthcare background. Contrast that with oncology, and you have to know a ton about cancer to innovate in that space. And so that by itself introduces a phenomenal barrier of entry for innovation. The second part is that data itself is very unstructured and very diverse. So it's not just breast cancer or liver cancer or lung cancer. It's subspecialty of breast cancer and subspecialty of liver cancer. So the diversity of data and the diversity of regimens and the diversity of workflows makes it difficult for one application to be useful across multiple areas. So the economics associated with producing a application that will be self-sustaining in a market is difficult. It requires a much heavier lift from a technology and innovation side to build that kind of base. And so as a result, we see a lot fewer really successful oncology applications. If you go to the App Store or downloadable apps and look in the cancer space, what you're going to find is a lot of reference material. Type in these symptoms and we'll recommend different diagnoses potential, but not a lot of interactive treatment type applications. And I think that goes back to the barriers that we just talked about. I think that really for the first time in a long time, I felt my focus shift from the IT to the health side of health IT. I think when you have a family member that's going through something like chemotherapy, it changes you. The process of chemotherapy is kill as much of the individual as you need to without killing all of them, right? And it's this destructive and devastating process that everyone does for the greater good, right? You're trying to save someone by hurting them, and the process of that, it's a completely different emotional investment that I've found in myself watching someone that I love go through that. And knowing what I know about health IT and knowing what I know working with hundreds of extremely bright and competent entrepreneurs and innovators and engineers, I see the gap in oncology as something that we need to change, that we need to crush. And that we can't solve everything about cancer, but there are other people that are focusing on other parts, right? It's extremely expensive. There's a huge fundraising arm of cancer. It takes very complex labs and studies, and so we have a huge academic research part of cancer. And the part that we need to focus on is allowing creative innovators to enter that space, whether it's from a provider perspective or a patient perspective. And we can do that. We're doing that in other places. We're lowering the barrier for other bright, competent people to enter that space. And watching a loved one go through chemo inspires me to do in oncology what we're seeing other specialties do. And it changes you.